Don't let your doctor say everything is normal, the questions that save your kidneys. Your urine foam levels are dangerously high. You need to stop immediately with the habit of walking out of your doctor's office with a simple "everything looks fine" and start using a strategic list of targeted questions instead. Did you know that many patients are told their routine labs are normal while their kidney filters are actually losing 10% of their function every single year? The standard tests often miss the early warning signs, leaving you under a false sense of security while your health is quietly
slipping away.
proteinuria, or the presence of albumin in your urine, is a biological red flag that many people overlook or misunderstand. This is not just a line on a lab report. It is a desperate SOS signal from your internal filtration system. If you ignore this leakage, the final outcome is always the same: a total loss of independence, the exhaustion of dialysis, or complete kidney failure. Your lifespan is directly tied to how quickly you address this protein leak. I am Dr. Matthias from Kidney Health 365. Statistics show that millions of Americans are currently living with chronic kidney disease, but 90% have no clue they are at risk. Why? Because the kidneys do not have pain receptors to tell you something is wrong. You might think your swelling, high blood pressure, or constant fatigue are just normal parts of getting older, but this silence is why kidney disease is known as the silent killer. It destroys your filters in total silence until it is too late. The key to protecting yourself is to take control of your medical appointments and your daily nutrition. By asking the right questions and removing the health foods that are secretly high in phosphorus and potassium, you can stabilize your condition. In this video, I will give you the 5 essential questions you must ask your physician and reveal 2 specific biomarkers that provide the real truth about your kidney health. The first question you must ask involves a specific ratio that is far more accurate than a basic urine strip, and it could be the difference between catching the damage now or missing it entirely. The first and most critical question you must ask your doctor is, what is my current ACR, or albumin to creatinine ratio? This might sound like medical jargon, but it is the single most important number for anyone noticing bubbles in their urine. Many patients feel relieved when a standard dipstick urine test comes back negative or shows only a trace of protein, but this can be a dangerous trap. Standard urine tests are often not sensitive enough to detect microalbuminuria, which is the very beginning stage of kidney damage. By the time a standard test shows a positive result, your kidney filters may already be significantly scarred. The ACR test is superior because it compares the amount of albumin, a vital protein, to the amount of creatinine, a waste product. This creates a precise ratio that tells you exactly how much protein is leaking per gram of waste, providing a clear picture of your kidney's filtration integrity, regardless of how much water you drank that morning. According to the KDIGO Clinical Practice Guidelines, which are the international gold standards for kidney care, the ACR is the preferred method for screening and monitoring chronic kidney disease. If your ACR is above 30, it is a clear warning that your glomerular filters are under stress and losing their ability to hold on to vital nutrients. I want to see how many of you have actually had this specific test performed. If you have only ever had the basic dipstick test or have never heard of a CR, please comment number 0 below. If your doctor has already measured your ACR and you are tracking this number, please comment number 1. This feedback helps us understand how many of you are getting the deep diagnostic care you truly need. Knowing if you are leaking protein is only the first half of the equation. Once you have identified the leakage, you need to understand the actual speed at which your kidneys are working. Most people are told a single number representing their filtration rate, but they are rarely told what that number means in the context of their age or their future. A single snapshot in time does not tell the whole story. You need to know if your filtration is holding steady or if it is on a downward slope. Let us look at the second vital question that reveals the true stage of your kidney health and whether your current lifestyle is successfully slowing down the clock. The second question you must demand an answer for is, what is my GFR, or glomerular filtration rate? What stage of kidney disease am I in? And is my number stable? Your GFR is essentially the speedometer of your kidneys. It tells you exactly how many milliliters of blood your filters are cleaning every single minute. A healthy GFR is typically above 90, but as we age or as damage occurs from high blood pressure or diabetes, this number begins to drop. The danger here is that many doctors will not mention a decline if your GFR is still above 60, even though a drop from 90 to 60 means you have already lost 1/3 of your total kidney function. You need to know your specific stage because the management strategy for stage 2 is vastly different from stage 4. More importantly, you must ask about the trend. A single GFR reading is just a snapshot, but the slope of the decline tells the real story. If your GFR was 70 last year and is 65 today, your kidneys are losing function at a measurable rate. Understanding this slope allows you to take action before you reach the danger zone. According to clinical data from the National Institute of Diabetes and Digestive and Kidney Diseases, identifying the specific stage of chronic kidney disease early is the most effective way to implement lifestyle changes that can prevent the need for dialysis in the future. I want to see how many of you actually know your current GFR number. If you have been told your blood work is fine, but you were never given a specific GFR value or told your stage, please comment number 0. If you know exactly what your GFR is and what stage you are currently in, please comment number 1. Keeping track of this number is your first line of defense against the silent progression of renal failure. Asking the right questions is vital, but the quality of the answers you receive often depends on the information you provide to your doctor. Many patients arrive at the clinic unprepared, forgetting to mention key symptoms or failing to show the physical evidence of their concerns. Your doctor only sees you for a few minutes, so you must maximize that time by being your own best health advocate. There is a specific way to document your daily habits and physical signs that will force your medical team to take your concerns more seriously. Let us look at a strategic preparation checklist you should complete before your next appointment to ensure nothing gets overlooked. To get the most out of your medical appointment, you must transition from being a passive patient to an active health investigator. Most doctors are under immense time pressure, often seeing dozens of patients a day. If you simply say your urine looks bubbly, it might be dismissed as normal turbulence. To prevent this, you need to bring objective evidence.
Start by taking a clear photograph of your urine in the toilet bowl.
This visual proof allows the doctor to see the persistence and density of the foam, which is a much more powerful diagnostic tool than a verbal description. Furthermore, you should keep a 3-day log of your fluid intake and your blood pressure readings. High blood pressure is both a cause and a result of kidney damage, so having a record of your numbers at home provides a more accurate picture than a single reading in a stressful clinic environment. You should also bring a complete list of all supplements and over-the-counter medications you are taking. Many people do not realize that common anti-inflammatory drugs can be extremely toxic to the kidneys. By presenting this organized data, you force the medical team to look deeper into your specific case. This level of preparation ensures that your concerns are taken seriously and that no detail is left to chance. When you present your data, the conversation will naturally shift toward how to manage your symptoms and protect your remaining function. One of the most common ways doctors address kidney stress is through cardiovascular management. However, not all treatments are created equal when it comes to the delicate tissues of your kidneys. Some medications do more than just lower your numbers. They actually change the pressure inside your filtration units to prevent further scarring. It is vital to know if the treatment you are currently receiving is specifically designed to act as a shield for your filters. Let us look at the third essential question you must ask regarding the medications that could be the difference between stability and decline. The third question you must ask is my current blood pressure medication a renoprotective drug, and is it specifically helping to reduce my proteinuria? Most people believe that all blood pressure medications work the same way as long as the numbers on the monitor go down. However, when you are dealing with foamy urine and kidney stress, simply lowering your systemic blood pressure is not enough. You need a medication that specifically addresses the intraglomerular pressure, the pressure inside the tiny filtering units of your kidneys. There are two specific classes of medications that are considered the gold standard for kidney protection, CE inhibitors, and ARBs, also known as angiotensin receptor blockers. These drugs do something truly remarkable. They don't just relax your arteries, they specifically dilate the efferent arteriole, which is the exit door of your kidney's filtration unit. By opening this exit door, they reduce the internal pressure that forces protein through the filters and into your urine. This is why these medications are often prescribed even for patients who do not have high blood pressure, as their primary goal is to act as a physical shield for the nephrons. According to clinical research from the American Journal of Kidney Diseases, these medications can significantly slow the progression of chronic kidney disease and reduce the amount of foam you see in the toilet. I want to know if you are aware of what you are currently taking. If you are on blood pressure medication, but have no idea if it belongs to the ACE inhibitor or ARB family, please comment number 0. If you know for a fact that your doctor has placed you on a renoprotective medication, specifically to stop protein leakage, please comment number 1. Understanding the purpose of your prescription is the first step in mastering your recovery. While choosing the right medication provides a chemical shield for your kidneys, you must also look at the physical workload you are placing on them through your diet every single day. Every gram of protein you eat must be processed and filtered, and if your filters are already scarred, a high-protein diet is like forcing too much traffic through a broken bridge. This leads us to the fourth vital question you need to discuss with your medical team. You need a specific, personalized number, not just a general suggestion to eat less meat. Let us look at how to determine the exact amount of protein your kidneys can safely handle without causing more damage and more foam. The fourth question you must ask is, based on my current GFR and protein leakage, exactly how many grams of protein should I consume daily to reduce the foam in my urine? This is where generic nutritional advice can become dangerous. For a healthy person, a high-protein diet might be a fitness goal, but for someone with scarred kidney filters, it is like placing a heavy weight on a broken limb. When you consume protein, your body breaks it down into nitrogenous waste products like urea and creatinine. Your kidneys must then work overtime to flush these toxins out. If your filters are already leaking, a high protein intake creates high internal pressure, literally forcing more protein through the holes in your glomerular membrane and causing that thick, persistent foam. You need a specific personalized number from your doctor or a renal dietitian. For many people in the middle stages of kidney disease, the recommendation is often 0.6 to 0.8 grams of protein per kilogram of body weight. However, if you are in an advanced stage, that number may need to drop even lower to protect your remaining nephrons. According to the National Kidney Foundation, a low-protein diet is one of the most effective non-surgical ways to manage the symptoms of chronic kidney disease and delay the need for dialysis. By asking for a specific target in grams, you move away from guesswork and toward a scientific plan that gives your kidneys the rest they desperately need to heal. I want to hear from you about your current diet. If you are still eating large amounts of meat or using protein supplements without knowing your daily limit, please comment number 0. If you have already started tracking your daily protein intake in grams to protect your kidneys, please comment number 1. Sharing your progress helps keep this community accountable and focused on real results. Managing your diet and medication with a general practitioner is a great start, but there comes a point where the complexity of kidney care requires a specialist's eye. Many people wait until they are in a state of crisis before seeking expert help, but the best time to see a specialist is long before the situation becomes an emergency. This brings us to the fifth and final question, which is about knowing when it is time to bring in a professional who spends every day focused exclusively on the intricate world of the nephron. Let us look at how to determine the right moment to transition your care to a specialist who can provide the most advanced protection for your future. The fifth and final question you must ask is, at what point do I need a referral to a nephrologist? A nephrologist is a doctor who has spent years specializing exclusively in the complex architecture of the kidney. While your primary care physician is excellent for general health and initial screenings, they are often managing hundreds of different conditions. When you have persistent foamy urine, a declining GFR or an ACR that is consistently elevated, you need someone who can look at your kidneys through a high-powered lens. Many people make the mistake of waiting until they are in stage 4 or 5, often referred to as the danger zone, before they ever speak to a specialist. However, by that time, the options for reversal or stabilization are much more limited. A nephrologist can perform deeper diagnostic tests, such as checking for autoimmune issues or rare mineral imbalances that a standard blood panel might miss. According to clinical guidelines from the National Kidney Foundation, early referral to a nephrologist is linked to significantly better long-term outcomes and a much slower progression toward kidney failure. Asking this question early forces your current medical team to assess if your case is becoming too complex for general practice. It ensures that you get the expert care you need while you still have a significant amount of kidney function left to save. I want to know where you are in your medical journey. If you are currently only seeing a general family doctor for your kidney concerns, please comment number 0. If you have already been referred to or are currently seeing a kidney specialist, please comment number 1. This helps us see how many of you are already accessing the specialized level of care required for long-term health. Taking control of your appointments with these 5 questions is the most powerful way to advocate for your own survival. You are no longer just a passenger in your healthcare. You are the navigator. By demanding clarity on your ACR, your GFR trends, your medications, your protein limits, and your need for a specialist, you are building a fortress around your health. As we wrap up today's session, let us summarize exactly how you should use this information during your next visit to ensure your kidneys remain healthy and your future remains bright. Every question you ask is a brick in the wall that protects you from the silent killer. Today, we have equipped you with a powerful toolkit to transform your next doctor visit. By demanding to know your specific ACR ratio and GFR stage, confirming that your blood pressure medication is renoprotective, setting a precise protein limit, and knowing when to ask for a specialist, you are taking the wheel of your own health journey. Remember, a standard physical is often not enough to catch the subtle leaks that lead to long-term damage. You must be the one to ask for the deep data that truly matters. There is no time to waste when it comes to your kidneys. These organs often fail in total silence, and by the time you feel physical pain or extreme illness, the damage may already be permanent. Every day you wait to ask these questions is another day your filters could be under unnecessary stress. Starting today matters because early intervention is the only way to stay off a dialysis machine and maintain your quality of life as you age. I want you to feel encouraged and empowered. While kidney issues are serious, they are not a life sentence. Thousands of people have successfully stabilized their function simply by becoming more informed and proactive. You have the strength to make these changes, and your body is remarkably resilient when given the right care and the right questions. Right now, I want you to take 2 simple steps. First, write these 5 questions down on a piece of paper or save them in your phone. Second, schedule your next appointment and commit to being heard. Please remember that this information is for educational purposes and should not replace professional medical advice. Always discuss these topics with your healthcare provider before making significant changes. If you found this guide helpful, please subscribe to Kidney Health 365 and hit the notification bell. To learn more about the lifestyle side of recovery, watch our next video, Foamy, Urine, 4 Fruits, and Daily Habits to Protect Your Kidneys. I am Dr. Matthias, and I will see you there.